as sadly my father passed away early this year. Who would have thought, little over a year after the World Health Organization declared the pandemic, that safe and effective COVID-19 vaccines would already be in use? Still, great challenges remain. While the rollout of these vaccines in developing countries is critical to protecting lives, building human capital and stimulating economic recovery, the current crisis is exacerbating inequalities throughout the world. And without access to vaccines, the gap will widen further. Ensuring developing countries can access, as well as safely distribute vaccines, call for strong partnership and cooperation. Over the next hour, we'll be asking, how are developing countries preparing for large-scale rollouts of vaccines, and what gaps in access and distribution remain? How are the private and public sector helping to address the challenge? And how can efforts to address this crisis help us prepare for future pandemics? There are plenty of ways to watch. We're streaming this event in English, Spanish, French and Arabic on World Bank Live and across our social channels too. World Bank Live is also where our experts are taking your questions right now. You can share your comments at any point using the hashtag #VaccinesForAll. We have an amazing lineup of guests. Take a look at what's coming up. So some really big names and big conversations to come. But first, we wanted to hear from young people who have been particularly affected by this pandemic. They've missed out on school and university, faced unemployment, and are often supporting family members, coping with mental health issues, and in some cases encountering gender-based violence. But they also have hope for a better tomorrow.
Nobody was prepared for the challenges that the COVID pandemic threw at us.
Virtual classes meant frequent power outages and all sorts of hurdles that posed as a difficulty to my learning.
Without the vaccine, obviously I'm a student, so meaning that my education is going to be gravely affected.
Because of Corona, 1 year has already gone by. If we truly want to change this notion of Nepal being a developing country to a developed country finally, I believe education is what will take us there.
Science's amazing achievement with vaccines will make me able to return to university and get that complete and thorough education I'm craving for.
I think in a developing country like mine, the biggest challenge would be, how do we first get vaccines to places where COVID has worsened pre-existing problems?
Our biggest challenge is to put in place a secure supply chain at national level.
Living in an archipelago consisting of over 17,000 islands can be very challenging, especially at times like this, where we have to mobilize vaccine distribution. Navigating logistics to remote areas in the country is one big problem that we still need to resolve.
Our biggest challenge facing vaccine distribution is fear driven by misconceptions. But me, I am not afraid. The vaccines are safe and effective and put us one step closer to restoring our world.
We will all be able to go back to how things were before this pandemic started. We will have social interaction without the risk of getting sick.
I'll be able to travel to my favorite places and spend quality time with my family. I can finally visit my grandparents and celebrate my grandmother's birthday safely.
That's good. With vaccines, I can move about freely to class and dance in public.
With vaccines, things will change because it will help restore our lives back to normal and bring peace to our restless minds.
Hearing from those young people, you really understand how important, how urgent it is that global vaccines deployment is successful. It is now my pleasure to introduce World Bank Group President David Malpass to share his perspective on this vital work. David, over to you.
Thank you, Anne-Marie. The COVID-19 pandemic has taken a heavy toll on the health and welfare of billions of people, and its impact threatens to reverse a decade of gains in human capital. Access to COVID-19 vaccines will be critical for saving lives. We've made up to $12 billion available for vaccination programs. Together with partners, we've supported over 100 countries to undertake rapid readiness assessments, identifying gaps, whether with cold chain infrastructure or health workers. Where there are gaps, we must move quickly to fill them. Our projects aim to do this. To have enough vaccines for developing countries, we must address two things. First, we need more production. IFC, our private sector development arm, has $4 billion available through its global health platform to help manufacturers produce vaccines, support production of essential medical equipment, and strengthen health services. And second, we need greater transparency around contracting arrangements between pharmaceutical companies that develop the vaccines and their contract manufacturers to create opportunities for increased and direct flow of approved vaccines. Further strengthening of private-public cooperation is important to rebuilding and strengthening health systems. Throughout our COVID-19 response, we're paying close attention to the need to protect and invest in people. Investing in health, education, gender, and social protection helps build resilience when countries face crises, whether from economic downturns, pandemics, or climate change. As countries return to sustainable growth, they will continue to face intense fiscal pressures. They will need to prioritize smart investments in people that deliver dividends for the future. It's critical to get economies growing faster and to keep more families from falling into poverty. These steps and our partnerships together within countries and across regions and globally are the essential building blocks to a sustainable and inclusive recovery. Anne-Marie, over to you.
Thank you, David. We're going to be hearing lots of great ideas on distributing vaccines, but we want to know what you think. We're running a special poll throughout this event, and we're asking, what do you think is the most important factor in ensuring the fair distribution of vaccines? Is it A, increasing vaccine production to meet demand? Or B, overcoming logistical challenges in storing and transporting vaccines? Or is it C, building trust through education and awareness campaigns? Cast your vote at live.worldbank.org, and while you're there, there's also an opportunity to upvote your favorite question. We'll be putting some of those directly to two of the bank group's top experts at the end of this event, when we'll also be revealing the result of the poll. Let's now take a closer look at the work underway in developing countries to prepare for large-scale vaccine rollouts. I am honored to be joined by a truly top-level panel of experts. Dr. Tedros Adhanom Ghebreyesus is Director General of the World Health Organization. Henrietta Fore is the Executive Director of UNICEF. And Axel van Trotsenberg is Managing Director of Operations at the World Bank. Thank you all for joining us today. Dr. Tedros, to you first. As the head of the organization at the forefront of the pandemic, you have stressed the global solidarity that is needed to fight it. Could you share with us what you mean by that?
As you may remember, when I called for global solidarity, I used to also say, and I still say, national unity. So national unity and global solidarity are important. And I will start with national unity. As you know, if this pandemic is politicized, and if there are especially politicization at the country level, then the crack between the different political positions could be exploited by the virus. And we have seen that in many countries. So the first thing countries should avoid is politicization of this pandemic at the country level. Because if it's politicized, then it will exploit. The virus will exploit. And at the same time, if there is national unity, that's the basis for global solidarity. Because there is already a consensus at the country level that can also bring global solidarity at the global level. So coming to the global solidarity means, maybe in simple terms, it could start from sharing information. Sharing, information about the outbreak so others can understand. It could be sharing the pathogen so others can use the pathogen to produce, technology. Then when technology is produced, it could be sharing technology, like vaccines, for instance. Sharing vaccines is solidarity. And not only that, solidarity means working together also, collaborating, coordinating the response together. But to be honest, since the pandemic started, the solidarity and national unity have been really not as good as one would desire. So even going forward, I think we need to still advocate for global solidarity, because the virus will not be defeated in a divided world. We need to share everything that we have in order to defeat this virus. And the sharing or supporting each other is not charity for me. It is actually in the best interest of each and every nation. As you know, the virus is changing quickly. We have mutation going on, and we have several variants actually coming from different countries. If the change in mutation of the virus is significant enough, if the behavioral change of the virus is significant enough, even the vaccines we have now may not work. So if you take one aspect of solidarity, sharing technology or vaccines, unless we increase the coverage of vaccines quickly and defeat the pandemic, the virus will get a space to continue to spread, circulate, and then mutate. Then you have more variants. And even those countries who have high coverage of vaccines will not be secure, because the new variant that may not be stopped by the vaccines we have will invade the countries who may have even 100% in few months with the existing vaccines. So it's in the best interest of all of us. Thank you.
Thank you. Thank you very much. Now let's turn to Executive Director Henrietta Fore. Henrietta, there are certainly many issues and challenges in terms of vaccines. Please tell us, what is UNICEF's position on those challenges at the moment?
So, Anne-Marie, one of our challenges is financing, and the World Bank has come forward with IDA financing. It makes a big difference in country readiness, in the procurement and the delivery of these vaccines, and a replenishment is coming. This will be critical for us to be sure that we are able to reach the poorest countries in the poorest areas. So World Bank financing makes a difference. It is part of this global solidarity approach that Tedros was just speaking about. So for a UNICEF that is on the ground and in many, many countries, this is important. So UNICEF usually is distributing, procuring vaccines that are routine immunizations for children, things like measles and polio and other vaccines necessary for a child's health. This is usually about 2 billion vaccines a year. Now we are procuring 2 billion additional vaccines for COVID. It is a massive procurement and supply operation. And with the World Bank and WHO, we do country readiness assessments so that there are national development plans and they can prioritize where these vaccines should go. But this enormous undertaking means that you need lots of pieces in the supply chain. So after we are able to procure the vaccines and deliver them to the countries, it's very important that countries are ready for them. So we've been working for years on cold chains, but this COVID time period has really tested the cold chains and how cold our chains are. We also need to work with the ministries of health, preparing and training the healthcare workers. Every vaccine is different, and you need to be sure that the workers, the healthcare workers, the front lines, have personal protective equipment, but they also have the knowledge to know how to do the vaccination campaigns. Then we also have a great need, which is communication to populations. So every population needs to know that vaccines work, that they are safe, so that people do get vaccinated. And this is an important part of building trust in societies, and it is important for every country. So there's many pieces to the puzzle, but country readiness is very much on our mind, and it is what we are working toward. Big undertaking, lots of partners. We do it with the World Bank and with WHO, but we're out there to help children and their families.
Thank you. Allow me to turn now to Mr. Axel van Trotsenberg. Axel, getting vaccines to developing countries is the first hurdle. Then, as vaccines arrive, there are many more hurdles getting the vaccines where they need to go before ending up reaching the people. How is the bank supporting countries on those two fronts?
Well, let me go to the first hurdle. As Tedros correctly said, we need international solidarity. But I would add, actually, we need to add fairness and urgency. Fairness is that all the developing countries, particularly low-income countries, have access to the vaccines. This is currently not the case. And this is a huge concern to all of us who are sitting. You know, Tedros has been calling for it, Henrietta have been calling for fair distribution of vaccines. We need to reserve a certain amount of the installed capacity for low-income countries. Otherwise, there is a huge risk that they will be left out and only getting the bulk of the vaccines next year. There's urgency to act. We cannot wait. We have to keep on that urgency. And I think this is certainly from the UN system to the World Bank, I think we are pretty much unified that this urgency is needed. Then we need, of course, the money. I think we have made available $12 billion for vaccine and the deployment of the vaccines for middle-income and low-income countries. And I think by the end of April, we should have committed about $2 billion. We're working with 40-plus countries on this. But as I said before, the money is great. But if you don't have the vaccines, then we have no results. So again, go back to urgently fairness and deployment that it needs to be. On the deployment, I think there has been a very effective and good cooperation with all the agencies helping developing countries. This is the WHO, that is UNICEF, that is Gavi, it's the Global Fund, that is a regional organization like PAO in Latin America. What we need to look is at the readiness assessment. I think we have done thus far together about 140. And you see various degrees of readiness. And therefore, what we are doing in our operations in coordination with the WHO or UNICEF to see how we can support countries in the effective implementation. This will be a continued effort on this, as well as that we need to monitor that it is correctly implemented. WHO has established a very useful priority list who deserves first the vaccines. We strongly urge countries to follow that advice so that indeed the most vulnerable gets first the shots, and then you work your way down. What clearly is needed, and this is that we don't see this readiness assessment preparedness as in isolation, but there has to be also medium-term healthcare or health system strengthening. And this is the longer-term agenda on which we all have to work.
Now, coming back to you, Dr. Tedros, what are the main bottlenecks when it comes to vaccine deployment and manufacturing? How do we address this at global, regional, and country levels?
Yes. So the first, thank you. I mean, there are many bottlenecks, but the first bottleneck is many countries, they have this narrow nationalism rather than enlightened nationalism. That's why they're moving into vaccine nationalism. And meaning the bottleneck here is lack of political will. I think it's better to say it openly. If the major countries agreed to solve this problem, to address vaccine equity, they can do it. They have everything. They have everything to do it. So the political will is missing. Then, of course, if you move into other issues with regard to manufacturing, one is, there is excess capacity to fill and, finish. We're not using that. So we have to identify companies who have excess capacity to fill and finish. The other is voluntary licensing. And there are, companies, hopefully, who would be willing to license their patents or to transfer their patents voluntarily and to a specific company that they want. Of course, there is some compensations to what they can ask, but that's the second one, or immediate. The third is, as you know, we have what we call CTAP in WHO. It's a coordinating mechanism to pull patents and use it, as a means for technology transfer. So that's one bottleneck that they're not using, although we have the mechanism, but it's not being used. The fourth is lack of use of the waiver in the intellectual property, in the TRIPS for intellectual property. That's actually the elephant in the room. That's one major bottleneck. As you know, the provisions in the TRIPS agreement was made to waive IP, intellectual property, during emergencies. We haven't seen any emergency like this in our lifetime. If we cannot use it now, then when are we going to use it? So these are the major bottlenecks, but the mother of all these bottlenecks is lack of political will, and even to the first question, weak solidarity, weak global solidarity. Thank you.
Thank you very much. Now, Henrietta, we hear that women and children are bearing the greatest brunt of the pandemic. How differently are women and children being impacted?
So, Anne-Marie, you are right. Women are often the primary caregivers, both as healthcare workers, but also at home. And as a result, they are really torn in every direction. And what happens is that women, their participation in work, in paid work, is reducing around the world. It's in decline. So we are concerned about women and their employment, and we are very concerned about all of these services that women and children usually access in their normal lives. They're either not able to get to them or the services are not available. So as Axel and the World Bank have been talking about world poverty, we have another 140 million children that are likely to fall below the poverty line with their families. 168 million children have been out of school for more than 9 months. 1 out of 3 children do not have access to any form of remote learning. And now, Anne-Marie, many children are getting their lessons online, either through a cell phone or a tablet or through a radio or television. And it's very important for children to keep getting these services, but it's not always available. And so often it is the woman in the household who becomes not just a parent, but a teacher. And then it is very difficult for her to then be out of the home and holding down a job. We're also very worried that many children will not come back to school, and it's particularly girls. So once girls are out of school, parents often think that they could help their elders in their family and look after them, that maybe child marriage would be safer for them. But it means that for every 2 boys returning to a classroom, maybe only 1 girl will return. So we're concerned about all of these services. It's having an enormous impact on women and children. And we cannot trade one crisis, the pandemic, for another crisis in which we lose the women and the girls and the children in our world.
And Axel, beyond addressing the ongoing health emergency, what advice are you giving to the countries in which you operate today in terms of being better prepared and increasing resilience for future crises?
So Henrietta powerfully summarized the effects this crisis has had and on women and girls. But actually, one can say on whole societies, we are making seeing an enormous reversal on the progress that we have seen over the last couple of years. So what is clearly is that we need to focus more on crisis preparedness. I think this will be a prominent topic also during the upcoming negotiations for the IDA 20 replenishment. We have been actually working on that, particularly as it pertains to natural disasters, but also we started also with pandemic as a result of the Ebola pandemic. Nevertheless, what we are seeing that very often this preparedness plan were on paper tigers, if you wish. They were nicely drafted on paper. What we have to say is we clearly need to embed it into the health system. And ultimately, we need systematic health system strengthening. This is hard work. The cameras won't be there, but I think it is the absolute necessary part that we have to do. We also should not only take a narrow view on that it is only health, it is the whole agenda best summarized with the SDGs, that we are not making progress on this. Education is a point, but in many, many other areas. So our concern is that we have to build back better, stronger, learning, and we need to keep the solidarity, not only in the health area, but across the development spectrum, and that only this crisis has shown only together we will survive, only together we will strive, and only together we will prosper.
Thank you very much. Only together we will prosper. On that, I'd like to thank all of our guests for this enriching discussion.
Merhaba, I'm Damla in Istanbul, and you're watching World Bank Group IMF Spring Meetings.
Successful global deployment of a vaccine will have an enormous impact on so many aspects of our lives. Let's remind ourselves of the difference it could make. Now let's hear from two organizations working on the front lines of the vaccine rollout. Executive Director of Global Programs at Save the Children UK, Gwen Hines, and Head of COVID-19 Crisis Management for the International Committee of the Red Cross, Esperanza Martinez.
Vaccination for all is entirely possible if we work together. We've made enormous progress over the past year on vaccine development, but none of us are truly protected until all countries have COVID under control. And the cost of not doing this is going up every day. For the first time in 30 years, progress on child poverty, hunger is going backwards. An entire generation have had their learning disrupted, and millions of children, especially girls, will never go back. So we need to act now. And for those who say it's too hard to reach the last mile, I can tell you it's not. We do it already with measles vaccinations, with meningitis. We work on Ebola with local communities. So please get behind the Kovacs initiative with money, donating surplus vaccines. Share technology and know-how. Invest in scaling up production in low and middle income countries. And most of all, commit to the principle that we should be vaccinating all vulnerable people without discrimination, wherever they live. Thank you.
I am sure that vaccination for all can happen if we put aside borders and politics and focus on our shared humanity. We need to make sure that everyone, disregarding of who they are and where they live, have access to vaccines, not only for COVID-19, but also for other preventable diseases that every year cause so many deaths and so much disability. We also need to make sure that healthcare workers and vaccinators can carry out their jobs without being attacked. And we need to remember finally that there are millions of people facing humanitarian crisis today, and their needs also need to be met. My hope, my wish for 2021 is that we collectively demonstrate that we can deliver, both in the humanitarian space and in the vaccine space. Thank you.
If you've just joined us, welcome. I'm Anne-Marie Diaz-Borges, and we're discussing the rollout of COVID-19 vaccines for developing countries. And a reminder that you can share your comments at any time using the hashtag #VaccinesForAll. Now, Gavi is a global vaccines alliance and a key partner in Kovacs, which is at the heart of the response to COVID-19. I am delighted to be joined now by the Gavi CEO, Dr. Seth Berkley. Dr. Berkley, welcome, and thank you so much for joining us today. Could you explain how Kovacs helps low and middle income countries get access to COVID-19 vaccines?
Thanks so much for the question. Kovacs was set up to try to accelerate the development and then the access of vaccines for every country in the world. But of course, the main thing we're focusing on here is the work we did to try to reach lower middle income countries. We created the Gavi Advanced Market Commitment to serve the 92 lowest income countries and to bring a very large portfolio of vaccines to them. That was necessary because we knew that there was going to be intense competition for vaccines, and therefore we had to make sure that those vaccines would be available. We've now delivered more than 30 million doses to 60 countries. And although it took us 43 days for the first vaccine to be used, that is much better than in the previous pandemic of swine flu, which occurred now about a decade ago. As you know, your country, Cabo Verde, received its first doses of the vaccine on the 12th of March. And although we obviously have many more countries to go, each country does really celebrate when this happens. It's a great moment for global health, for the countries that have worked to build up their systems, and of course for the people who receive this vital protection.
Thank you so much for mentioning my country there, my dear country, Cape Verde. That first dose of vaccine was such a source of celebration for the whole country, so thank you for mentioning. Dr. Berkley, how confident are you that low and middle income countries will be able to vaccinate at least 20% of their populations by the end of this year?
So the first step, of course, in doing this is having adequate finance. Donors have been very generous. We've raised $6.3 billion so far, and we're hoping to get another $2 billion by June. we've been really working hard to overcome all of the problems in supply that you've heard about in the media. And through our diversified portfolio, we're on track to deliver 1/3 billion doses by mid-year and then 1.3 billion doses by the end of the year so that countries can protect their most vulnerable populations, including healthcare workers. Of course, we believe that countries, and they want to go to a higher amount of the population than that. So we think that if we get adequate finance, we can actually get to 1.8 billion doses by the end of the year. Of course, there are still questions on whether we just want to linearly increase the amount of vaccine, or will we need boosters or different vaccines for the new variants? And of course, these questions will have to be resolved.
And what are the main challenges and opportunities that Kovacs is facing in delivering vaccines to low and middle income countries?
Of course, during this moment is an unprecedented time. We have to get to large amounts of the population. To be able to do that, we had to create new systems to deal with things like indemnification and liability, to create a new no-fault compensation scheme, since there wasn't adequate time to deal with the normal ways of dealing with those type of problems. We've also had to work with countries to be able to develop their delivery systems to make sure they were able to move these forward. These types of interventions are really important, but what we're hoping is that we can build them sustainably so they will be there in the future to be able to deal with these systems. At a time when there is an unprecedented demand for vaccines, we also have to work to make sure that manufacturers will keep to the deals they make and make sure that these vaccines are available.
Dr. Berkeley, this has been a pleasure. Thank you so much.
Thank you. Nice to talk to you.
I am Sandrine Nina in Bujumbura, Burundi, and you are watching the Weltbank Group IMF Spring Meetings.
Now, frontline workers and community leaders have been celebrated as the true heroes of these times, risking their lives to protect ours and helping educate, distribute, and deploy vaccines. Let's hear from some of them now about the challenges that they face.
One of the biggest problems we are facing is equitable access. I believe that every healthcare professional in every part of the country deserves access to the vaccines.
No country can do it alone, so cooperation, especially in the case of vaccines availability and distribution, is key.
And one of the major issues with distribution in my country will be people rejecting the vaccine, the fear that people are harboring due to the theories they've heard, due to fears of complications associated with the vaccine.
Misconception and miscommunication and misinformation among the general population.
So probably more education may have to go into the vaccine distribution.
На мой взгляд, на сегодняшний день в социальных сетях и очень много разной информации, по большей части недостоверной информации про вакцинацию.
By vaccinating against COVID-19, we will be making an effort together to fight the fear we have been living with in the past year.
We are stronger, more experienced, and united.
Vaccination will expedite a transition towards our normal, happy life.
Vaccines are going to change my life because my patients will get to see my smile again because I don't have to put on a mask.
It means a new start. It means a second chance. It means that we all face a pandemic. We must be grateful to be alive. That means value life more. Because as we know, it can change in a blink of an eye.
So humbling and helpful to hear those perspectives, and a timely reminder of the challenges that we must overcome together in order to successfully deploy COVID-19 vaccines and get this pandemic under control. It's clear that this challenge cannot be resolved by any one player alone. It will take partnerships across sectors and fields. So how can the private sector best contribute? That's what our next guest will help us explore. Jérôme Thiel is Deputy CEO of Serba Healthcare, which manages an international network of clinical diagnostics laboratories and is active across sub-Saharan Africa, where its labs are proving a key resource for much-needed large-scale testing for COVID-19. And Maktar Diop, Managing Director of the bank group's private sector arm, the IFC. First to you, Jérôme. I understand that in 2019, Serba significantly expanded its presence in Africa. Can you talk to us about what Serba is doing to help expand testing in developing countries for COVID-19 and other pandemic fighting steps?
Thanks, Anne-Marie. Indeed, Serba has a long history of providing specialty testing for African private and public labs from its historic lab in Paris. Based on a long parallel partnership with Lancet Laboratories from South Africa, where we deal for clinical trials and central lab in this country, we decided together in 2018 to create a joint venture, Serba Lancet Africa, to operate and expand network of proximity labs to provide African population with high standard quality testing at affordable cost. As a result, we are now present in 13 countries with more than 70 labs, 1,500 employees, and serving more than 1.5 million individuals. When the COVID crisis arrived in Europe last year, we were immediately and very intensively asked to fight against the response to this crisis with developing a lot of PCR testing. Simultaneously, we anticipated the outbreak and the spread of the outbreak in Africa and liaised immediately with our teams on the ground to develop a war plan in order to be able to propose PCR testing solution to populations and authorities. Thanks to the dedication of our colleagues on the ground and the support from the group for technical aspects, scientific and also procurement issues, we have been able to install some PCR platforms in most of the countries where we operate. And since then, we have done more than 300,000 PCR tests. We invested on our own more than 2 million during this moment. I think that our value added into this project is clearly to have a local presence and to access rapidly to the population. We also serve the medical communities with efficient diagnostic in this field, with the appropriate turnaround time, also with an efficient pricing and full transparency for authorities. In the COVID pandemic, we can also help in through our local facilities and trained staff to boost vaccination. And obviously, this model can easily be replicated for unfortunate other pandemics that may occur.
So one of your aims there to really strengthen your local presence. Jérôme, can you now tell us what other opportunities do you see for the private sector in helping countries meet the healthcare needs of their population more broadly?
So you're perfectly right, because we think that the private sector and specifically the long-standing players have a lot of experience and capabilities to help improve the sanitary sector and system in Africa. First of all, we are convinced and we have proven in more developed countries that diagnostic and prevention is absolutely crucial to rapidly and with moderate financial cost improve the access to healthcare for the population and also control the pathologies development. Second, as I already mentioned, the private sector has a presence on the ground with easy access to patients, which are key into any sanitary policies. We have a dense network of collection centers, and we also develop a lot of new solutions such as point of care or mobile units in order to expand this presence. Third, we also have access to robust and innovative scientific and technical solution to provide the high quality diagnostic to the population. We also have very well experienced and trained teams to find also the appropriate solution for patients. As a private companies, we are used to invest and to develop adapted solution, provided we at affordable cost, obviously, provided we have a stable and quite transparent regulation environment. As an example, Serba runs more than 200 labs worldwide for hospitals, either public or private institution. And finally, and I think it's important, we invest a lot in training, which is key to increase the sanitary awareness of the populations. At Serba, with our in-house Serba University, we have a pluriannual plan to train most of our colleagues in Africa. And also, perhaps, I think it's something we will expand later on, the private sector could also work with the local public authorities in the development of vaccination for the COVID outbreak.
And now to you, Maktar. We have heard about the challenges of getting the vaccines to people in developing countries. From your vantage point, leading IFC, what's the role of the private sector? And Jérôme, I think, will be very interested in knowing. So what's the role of the private sector in helping countries meet their goals?
Thank you very much, Anne-Marie. The role of the private sector is multiform. First, on innovation, production, research, R&D on vaccine is done from the private sector with the support of the public sector, but a lot of the development are done by private companies. So this is an important part. The second one is the logistics. One thing is to produce the vaccine, to have the research, to have those in place. Another thing is to have them in the arm of the citizens. So all the logistics part I've seen recently in advanced countries is a big challenge. And the private sector can play a big role in helping and using new innovative mechanisms to be able to deliver those vaccines to the population. The third element is to help building a resilient system. We know that we had an outbreak like this. I was a vice president for Africa when we had the Ebola crisis, and I've seen firsthand how this crisis also, an epidemic, has a huge impact on economic development in Africa. We have a crisis of a larger magnitude now, but what is so is that for lots of developing countries, the health system is not resilient enough. So what we are doing is, as we are working in addressing the short-term needs, we are also working towards helping building a much more resilient system. It means that we need to think not only about the private sector as an agent of building infrastructure for health services, but also to be a service provider and change totally the model whereby the public sector doesn't necessarily have to invest heavily in infrastructure, in equipment, but to buy services from the private sector to be able to do testing, to do X-ray, to do a certain number of things. Lastly, how to strengthen the value chain. The value chain, the production chain is important to strengthen. We realize that in some countries, not only they don't have vaccine, but they don't produce syringes, they don't have swabs, they don't have equipment. So we are partnering with support of our donor countries to put in place a system where we can be using the textile industry more efficiently to be able to produce garment and equipment to protect workers. So there are many dimensions to what we can do to support the health system and make it much more resilient and responding also to the short-term crisis.
And Maktar, it is clear that solving critical health needs, such as around COVID-19, requires partnerships and innovation. What is IFC's strategy here?
We have, our strategy is to build on the effort of government. For instance, recently our public sector branch, the World Bank, provided a loan to Cabo Verde to face the COVID crisis. But also we would like to build on this to build a resilient system. So what are we doing and what can we do to accelerate it? We need to ensure that the regulatory framework is strong enough. When we see the very sensitive sector where this investment decisions are not easy to take and have a long-term sometime a payback period and have a long-term a financial decision which have long-term implication. So we need to have much more certainty on the environment for investors to be able to come, and Jerome alluded to it. So our public sector part of the World Bank is working to help governments strengthening the regulatory framework so we can crowd in private sector. Secondly, we want also to bring the local private sector to look at also the pharmaceutical industry to be able to invest it. So it will be not only FDIs, it will be FDIs, but also local investors who will be more and more looking at this sector as being a sector in which we can invest and have a high return. So third element is investing in skills. This is in those labs that you mentioned, you require very well-trained and very specialized people. So we can use the private sector, as Jerome mentioned in his company, to train academics, to train researchers, to train health workers to be able to use that equipment to do the research, but also to combine those services with what the government is doing to be able to support. So it's clear that here we are talking really about a joint effort between government and private sector, and the space is huge. So there is space for both private sector and public sector to do more, because medical needs in least developed countries are huge and very important.
So it will truly require a joint effort there. And with that, I'd like to thank you both for such an important and enlightening discussion. Merci beaucoup.
Merci beaucoup, Anne-Marie.
Hello, Luyumi, everyone. I am Leisande in Port Vila, Vanuatu, and you're watching the World Bank Group IMF Spring Meetings.
If you've just joined us, I'm Anne-Marie Diaz-Borges, and we're discussing the rollout of COVID-19 vaccines for developing countries. I hope you've already learned something new, and for those interested in diving even deeper, we've pulled together some key fact sheets and blogs. Just scroll down to the resources section of our World Bank Live page. And while you're there, cast your vote in our poll. A reminder, we're asking you, what do you think is the most important factor in ensuring the fair distribution of vaccines? Is it A, increasing vaccine production to meet demand? Or B, overcoming logistical challenges in storing and transporting vaccines? Or is it C, building trust through education and awareness campaigns? We'll be sharing the results live at the end of this event, so keep watching. As this poll highlights, effective delivery and health systems are an important part of vaccine deployment. Let's take a closer look at this challenge and at how the World Bank Group has been responding.
Many vaccines need to be kept cool. Some need to be kept cold, very, very cold. From factory to patient, they need to be refrigerated in warehouses, trucks, planes, cars, even motorbikes. And that's just one small part of a vast, interconnected health system. That's why the World Bank is providing $12 billion to equitably distribute COVID-19 vaccines, with priority for those that need it most urgently, and strengthen the health systems that deliver it. Train and equip frontline health workers in cities, suburbs, and rural communities. Support health centers that care for patients, but also collect and share information to identify hotspots or have insight into where infections could flare up. And make sure there is equipment, training, financing, and more to be prepared so the next disease outbreak isn't so devastating. Just focusing on COVID doesn't make an effective health system. Preventative care for people must continue, especially for women and children. Life-saving treatments for chronic conditions must continue. Other health and medical needs don't just go away. And outreach is especially important. From past vaccinations, we've learned that we need to inform people and battle stigmas, misinformation, and distrust. Vaccines, testing, and treatment are vital to turning the tide against the pandemic, but improving health systems will rebuild livelihoods and economies, and hopefully make healthcare better than before.
Let's turn to our final discussion and look at what can be done now to learn from this crisis to help developing countries respond to the next pandemic. Are there lessons that could strengthen resilience and help countries better prepare for future shocks? I'm joined now by a truly esteemed panel. Ngozi Okonjo-Iweala is the Director General of the World Trade Organization. Dr. Richard Hatchett is CEO of CEPI, which stands for the Center for Epidemic Preparedness Innovations. Dr. Gro Brundtland is the co-chair of the Global Preparedness Monitoring Board, former Prime Minister of Norway, as well as former Director General of the World Health Organization. And Mari Pangestu is Managing Director of Development Policy and Partnerships at the World Bank. Welcome to you all. Ngozi, first to you and congratulations on your new position as head of the World Trade Organization. You were selected to head the WTO in February of this year, almost 1 year after the pandemic began. What do you see as the greatest economic impacts that developing countries are bearing during this global crisis?
Well, thank you so much, and thank you for congratulating me. Let me just say that before we talk of economic impact, we have to look at the health impact, because the biggest thing for economic recovery for developing countries is getting the vaccines that they need in order to deal with the pandemic. I often say the biggest economic stimulus for developing countries would be access to these vaccines. So that's the first. But developing countries have been hit in so many ways. Commodity exporters have faced plummeting prices. Travel and tourism for those countries that depend on this has collapsed in many countries. And even those well integrated into global value chains, they've suffered from some of the closures of factories and borders and so on. So there's been a lot of impact on developing countries. And as you can see, for 36 years, poverty has been declining. From a figure of about 3 decades now, poverty has been declining. And in 1990, 36% of people were living in extreme poverty. Now, in 2018, this fell quite substantially to about 10%. And now, for the first time, it's climbing back up. And the World Bank projects that 150 million people could fall back into poverty. So you can see how the impact of this has really been very dramatic.
Thank you very much. Thank you very much also for reminding us of the issue of poverty, which, definitely needs to be mentioned here as well and linked to the pandemic, especially when we're talking about Africa. Now, Dr. Hatchett, CEPI is an organization that helps finance research in global public goods, such as vaccines. Can you explain the role that CEPI has been playing during this pandemic?
Thank you. We've played an evolving role, actually, in the first stages of the pandemic. Last January, February, March, we played an important role in initiating vaccine development programs. We actually established our first partnerships on January 23rd. There were fewer than 700 cases of COVID globally at that point. And we've ultimately established one of the world's largest portfolios of COVID-19 vaccines. Since last spring, we've also been focused intensively on ensuring access to those vaccine products. We used our investments in innovation and R&D to create access commitments for our partners who would then provide that vaccine into what became the Kovacs facility, which, of course, I think everyone is aware is a facility for procuring vaccine and delivering it to all participating countries, but particularly to those countries, the impoverished countries that would not otherwise have access to vaccines. Finally, in the last few months, we've begun to focus on continuing our R&D investments, but thinking about making sure that the world has access to the vaccines that it will need to manage COVID in the long term and to address the emerging variants that have given so much concern recently.
Thank you very much. Allow me to turn now to you, Dr. Brundtland. You are now co-chair of the Global Preparedness Monitoring Board, which in 2019 warned that we were a world at risk. Last year, in the midst of the pandemic, you came out with a world in disorder. Where do you see us now?
Well, we have a world of contrasts. Vaccine production has provided hope, but trust in global leadership has been eroded. Our weak global structures and systems for preparedness have been exposed. In our reports, we recognize that equitable access to COVID-19 vaccines should be a crucial issue. It's a moral imperative, it's a public health imperative, and an economic imperative. The rapid development of vaccines for COVID-19 has been remarkable, but it is all the more devastating that while science has advanced, the world has stalled in terms of equity. The poorest countries are seeing virtually none of the benefits of COVID-19 vaccines. We are stuck where we have been for 30 years, reliving the unequitable responses to previous emergencies. The board called for the initial production of COVID-19 vaccines to be allocated equitably to all countries to ensure each country had enough vaccines to cover 2% of its population for health workers and the most vulnerable. This means around 300 million doses. 475 million doses have already been allocated, yet the large majority of lower income countries have vaccinated less than 1% of their population, and many of the poorest countries have yet to receive a single dose. The lack of global mechanisms for vaccine development and access are at the heart of the problem. We have well-established systems for research and development which rely on the incentive of IP and competition. Securing access to countermeasures has been based on advance purchase agreements. Access to countermeasures by lower income countries have depended on donations and development assistance, relegating them to the bottom of the list. Vaccine delivery continues to be determined by economic power, production capacity, and competition, rather than public health, and unacceptable failure of global preparedness. And I say this despite what has been done by CEPI, which is very helpful, but not enough.
Thank you very much. So a world of contrast, very strong words there, and so befitting, absolutely, to what we are witnessing at the moment. And now to Mary Pangestu. Mary, the World Bank plays an important role convening global institutions and countries. How are partners coming together at the global, regional, and country level to address the and prepare for the future?
I'm glad you asked that question. The World Bank is working with many partners, and I think this has been an incredible example of partnership, starting from preparing all the way to delivery. We are working with WHO, UNICEF, Gavi, Global Fund, and the Gates Foundation. So starting from the technical and conceptual level of how do you design the readiness back in the middle of last year. And then in November, there was an agreement of how would you design a vaccine readiness assessment framework, which can then be tested on country, which will then be applied at the country level. This was agreed in November, and we also agreed that we would roll out readiness assessments in 100 countries in 100 days. And we actually did it. And that was a partnership, so a partnership in the design and then partnership in the assessment at the country level with all those partners on the ground. Of course, working with the countries and assessing their coordination and their planning, their targeting, their cold chain infrastructure readiness, the workers, the communication, the regulatory aspects. And that readiness allowed us to assess the gaps that existed in countries and therefore the financing that was needed. And then the partnership came in again on the co-financing, whether it's bilateral donors, regional development banks, multilateral development banks, grants, and how much the country also had resources. And then on the access for vaccines, fair and equitable access, of course, we work with Kovacs to provide the first 20% of delivery and also work with countries on other access for above the 20%. And then finally, working with countries to develop their national deployment and vaccination plan on the ground and supporting them. And at the same time, looking out as to how they would also build out and strengthen their health systems at the same time. And the World Bank works very closely on the ground with UNICEF, with WHO, and other partners, and also, of course, with the countries themselves.
Thank you very much, Amari. Going back to you, Ngozi, following up on what we've heard and going forward, how can we strengthen the global economic architecture to better prepare against future shocks?
Well, thank you so much. I'd like to make 4 points on this. I think that the first is that we should have a better preparedness and response system in place. And when I talk about preparedness, I'm talking about surveillance and early warning systems, whether we are talking of pandemics or diseases, or whether we are talking even of climate change related kind of disasters. The world needs to invest in surveillance so that we can get early warning. So that's the first. I think the second point is that we should put together a financing framework that would help us deal with finance both the preparedness part, but also finance the response in case we don't get the warning on time. And what is very difficult now in the world is the fact that preparedness is probably a tiny percentage, maybe 1% of the monies we spend on response. If you look at the trillions of dollars we spent in this pandemic, just responding to the health and economic issues, if we had spent maybe 100 or 200 billion on preparedness before that, we would have been better off. So we need to put together a sensible financing framework. And I think that the third point I'd like to make is that we need to keep supply chains open. Of course, coming from the trade side, I would say that, but we've seen that trade has helped us manage this pandemic and has made the economic impact perhaps better able for governments to handle than it would have been, even the health impact, because we've been able to move through trade, medicines, vaccines, PPEs from one country to the other. So keeping supply chains open is a very important part of the response. So those 3 points I think are vital for us to be better prepared next time and safeguard our economic systems better.
Thank you very much. And when it comes to supply chains, we have seen how much Africa has suffered in many a time. So thank you very much. Now, back over to you, Dr. Hatchett. What do you see as the most pressing priorities for CEPI as you continue to support the development of vaccines for this particular pandemic, but also for the accelerated development of vaccines for future pandemic outbreaks?
Thank you. First, I think we need to build on the accomplishments and the improvable models, really both technical, institutional, and operational that have emerged from the pandemic. We have compressed a decade's worth of technology into perhaps a year. We will emerge from the pandemic with new tools that will allow us to prepare for the future. We have laid out the model with Kovacs and the ACT Accelerator that are improvable. They're not perfect, but they lay the foundations for future institutional responses. CEPI as an organization has now laid out its own plans for the next 5 years for what we're calling CEPI 2.0 that would entail investment of about $3.5 billion. It would focus on strengthening our defenses against COVID, certainly, trying to take coronaviruses as a threat class off of the table, developing vaccines as we were prior to COVID for known threats like Lassa, MERS, Nipah, Ebola, working to compress vaccine development timelines. We delivered licensed vaccines this time in 326 days. We'd like to shorten that to 100 days. Building a library of prototype vaccines that would enable us to respond rapidly to any future threat. Establishing global networks for clinical labs, assays, clinical trials, and finally supporting the efforts of low and middle income countries to provide for their own national health security.
Thank you very much. It's true that this pandemic has truly been a period of very rapid innovation and development of so many different new technologies, like you've just mentioned. Going back to you, Dr. Brundtland, what do you see as the most crucial gaps that the global community needs to address to help ensure we are better prepared for future health crises?
Well, the start of the current pandemic revealed shortcomings at all levels. We need an international agreement in place to support and strengthen our international institutions, the WHO, the international financial institutions, in order to deliver on such an agreement. Ultimately, the success of an international agreement on pandemic preparedness and response will rely on money. We now need to address the historic underinvestment in preparedness. Investments have represented a fraction of what is required. Funding in millions, what should have been in billions. The board estimates that an additional annual investment of $5 per person will be needed. With the trillion spent on the COVID-19 response, as we just heard from WTO, we are paying the price for past sticking plaster funding. Now we need to fund future preparedness at the scale required. We must develop appropriate funding and financing mechanisms for preparedness, which do not rely on ODA and are predictable and sustainable. The board quickly realized there was a lack of mechanisms to finance global public goods. This must be addressed urgently. In particular, I want to challenge the World Bank to develop a mechanism to remedy the present inequity in vaccine distribution. This future mechanism should be based on agreements with vaccine producers and on pre-commitments from lower and middle income countries. It should provide upfront financing of vaccines to IDA eligible countries so that vaccines arrive at the same time as they do in higher income countries. The ugly truth is that at this stage of the COVID-19 response, we are seeing how money talks. In the absence of appropriate global financing structures, resources are flowing to the rich. We will all pay the price in terms of economic damage, global instability, and a prolonged pandemic. The world was unprepared for this catastrophe. Unless we change our systems for financing and allocation of global public goods, we will face the same problem in the next pandemic. So I call on you to ensure that this does not happen.
So money, the heart of the issue here, like it's it is often the case. You've mentioned preparedness, just like Ngozi had as well, so we need to pay attention. Thank you very much. Now, going back quickly to Mari. Mari, you've talked about the important role of global partnerships to address health emergencies. How is the World Bank supporting countries as they prepare themselves for future emergencies?
I'd like to make 3 points to answer your question. I think first, we're learning a lot as we are responding to this pandemic and rolling out our program. As I mentioned earlier, we already have vaccine readiness assessments in 144 countries, and we're already deploying almost $4 billion in around 11 countries already, and then another 40 countries in preparation. So we're learning a lot as we're doing. So the 3 things I would mention on what we've learned. First, that as we are rolling out the response to the pandemic, we must not forget some of the priority health issues, such as making sure that health services for women, maternal health care, and so on are not, and children immunization are not put by the side as you are responding to the pandemic. So, that's one area of key importance. Second, as we are rolling out our program, we're learning a lot on the ground as to how you can actually, as you do your preparedness, also build out for a medium-term strengthening of the health systems, whether it's the infrastructure, whether it's the training of the health workers, and a very important role of technology, the possibility to have information on those getting vaccinated, monitoring it, and so on. I think this can really be important for the future to prepare yourself for the future pandemic. And many things that we learned on the ground can be helped to be used to help develop the stronger systems. And thirdly, I think to Dr. Brundtland's point about manufacturing capacity and supply chain, I think we're also learning a lot about that. Supply chain was mentioned by Ngozi. So I think here is where it's a combination of cooperation, a global cooperation. How do you use concessional funding to have certainty and to work together with the private sector? So the IFC arm, the private sector arm of the World Bank, has a health platform, and they are actually investing in manufacturing capacity dedicated for least developed countries. So I think this is actually an area where we all need to come together to make sure that we can have fair and equitable access to vaccines now, as well as obviously in the near future for future pandemics.
Thank you very much, Mari. And I would like to thank you all for such an insightful discussion.
Namaste, I'm Shilpa in New Delhi, and you're watching the World Bank Group IMF Spring Meetings.
Now we are nearly at the end of the final public event of the 2021 Spring Meetings. We hope you've enjoyed all the sessions this week, and a reminder that you can watch them all again at live.worldbank.org. You can also continue to share your feedback on anything you've seen or heard using the hashtag #ResilientRecovery. And there's much more to come. In just a minute, we'll be joined by Paul Blake, who is live in the World Bank Group's headquarters in Washington, D.C. He'll have the results of our poll, and he's also joined by the World Bank's Vice President for Human Development, Mamta Murthy, and Stephanie von Friedeberg, the IFC's Senior Vice President of Operations. They'll be taking your questions and sharing their thoughts on a fair and broad vaccine rollout in developing countries. But first, we're going to end this session with a very special performance. Petit Tonton is an actor, director, storyteller, and writer from Guinea in West Africa, and he's composed a tale just for this occasion.